Hello, everyone. I am Dr. Joseph Dzierzewski, Vice President of Research and Scientific Affairs at the National Sleep Foundation. This is my good friend and colleague.
Hi, I'm Dr. Natalie Dautovich. I'm the Environmental Fellow for the National Sleep Foundation.
Today, we're going to be speaking about drowsy driving and sleep health. The National Sleep Foundation is dedicated to improving well-being and health through sleep education and advocacy efforts.
And here are the goals of the National Sleep Foundation. Sleep health is accepted as a crucial measure of overall health. The natural sleep-wake process is understood as the basis for healthy sleep. Community, infrastructure, and environments respect sleep health. And sleep science and insight are rapidly incorporated into accessible health products and services.
Now, as you know, Natalie, at the National Sleep Foundation, we work tirelessly, no pun intended, to advance theory and research, awareness and education, and practice and behavior, all as they pertain to sleep health and sleep health equity. All of this culminates with NSF's promise to the public to help everyone and anyone be their best slept self.
And how can we be our best slept selves? Well, there's 6 small steps that you can take towards better sleep. I think it helps to think about these as what can I do during the day and what can I do in the evening. So starting with the day, light is so important. Try to get exposure to bright light, outdoor natural light if you can. Also try to engage in regular exercise. So 30 minutes, 5 days a week is great. And then if we can be consistent in the timing of the meals that we have during our days, this also helps to promote healthy sleep.
Those don't seem too difficult.
No.
We also have some evening tips that we'd like to share. The first one is to avoid stimulating substances near bedtime. So we tell everyone to avoid nicotine, caffeine, and alcohol close to bedtime.
Mm-hmm.
We also recommend everyone enjoy a relaxing wind down routine, keep consistent bed and wake times, and allow yourself 7 to 9 hours of sleep. And lastly, we know how important the sleep environment is for people to get a good night's sleep. So we want everyone to keep their rooms cool, quiet, and dark.
Yeah. Think of a cave, but without damp.
Exactly. Exactly.
So when we're talking about good sleep, it helps us to feel good, but there are also important reasons why we should try to prioritize sleep.
And the place where I usually start when I think about the benefits of good sleep is right here with your heart. Sleep is essential for good cardiac health. In fact, the American Heart Association has included sleep duration as one of their pillars for heart health.
Sleep is also important for maintaining a healthy weight and metabolic health. Also, our well-being, mood, and preventing depression and anxiety are dependent on good sleep.
Relatedly, our social interactions, our social functioning are all related to how well we have slept.
As well as our immune health and functioning.
And our ability to think, remember, pay attention, and focus, what we would largely call your cognitive abilities, are greatly dependent on quantity and quality of your sleep.
And something else that sleep is important for is safe driving. So we know that drowsy driving is really impaired driving.
Without a doubt, Natalie. In fact, very rigorous research has shown that 18 hours without sleep is equivalent to a blood alcohol concentration of 0.08, the level that's legally impaired in all 50 states.
Yes, very serious. So what do we know about how much sleep we need in order to drive safe?
That's an excellent question, Natalie. The National Sleep Foundation convened a group of national and international experts on this very topic. Those experts reviewed all the available science and came to some very clear conclusions and recommendations. The first thing they suggested is that if you're getting no or very little sleep each night, 0, 1, or 2 hours of sleep, you are unfit to be behind the wheel. You should not be driving that way. If you're getting an intermediary amount of sleep, think about 3, 4, or 5 hours, In this case, you should use very high caution. Likely, you should not be behind the wheel, but if you are, it's very, very risky. And lastly, if you slept more than 6 hours per night, our experts think that you're pretty well able to drive at that point.
That's really helpful, Joe. So, what are the drivers themselves saying about their own readiness to drive?
Yeah, interestingly, here, the expert recommendations don't appear to have translated into driver confidence. What I mean by that is that nearly 2 out of 10 drivers, when surveyed, have confidence in their ability to drive when they've slept very, very little the night before. In fact, nearly 4 in 10 drivers express confidence in their ability to drive if they slept only 3 to 4 hours. That number rose to almost 80% of drivers having confidence in their ability to safely drive when they've slept between 5 and 6 hours the night before. Again, all of these levels are levels where you should not be driving or where you should have extremely high caution. Now, lastly, a place where our experts and drivers agree would be if you slept more than 6 hours, nearly 100% of drivers suggest that they have high ability to drive safely.
That's really helpful to think about the fit between driver perception and the actual data. When we're thinking about drowsy driving, it's important to think about the consequences associated with it. So, how big a problem is this? Well, we know that the National Highway Traffic Safety Administration and AAA have each conducted significant research to estimate the scope of the drowsy driving problem. Estimates range from 90,000 to 100,000 drowsy driving related accidents occurring per year.
Wow.
And importantly, the vast majority of experts agree that the problem is likely much wider spread, likely 3 times the size of these estimates.
Here at the NSF, we have our own data that suggests that the vast majority of adults, 60%, have engaged in drowsy driving, defined as having driven while so tired that you have a hard time keeping your eyes open. So this is a big proportion of the US population. Importantly, we also know that drowsy driving is concentrated within specific communities. For example, young drivers, teens. We know these groups are at elevated risk for not only drowsy driving, but also the consequences associated with drowsy driving, accidents. This is even more true, or especially true, for young males.
Other factors to consider beyond age are occupations. So we know that shift workers, individuals with rotating shifts, or individuals with extended working hours experience a 6-fold increased risk for drowsy driving. And commercial drivers are also at an elevated risk for drowsy driving. Another important point to consider is that we find that marginalized or underrepresented individuals are more likely to be concentrated in these types of occupations, making them more at risk themselves for drowsy driving.
That's a good point, Natalie. And in fact, data collected by the National Sleep Foundation indicate that individuals who identify as either Black or Hispanic are at a much more high risk or much more likely to drive drowsy on a regular basis. So they do so more frequently. And when you engage in a risky behavior at higher frequencies, you're more likely to experience negative outcomes associated with that behavior.
So we see the occupational risk playing out here. Beyond the immediate personal consequences of drowsy driving, the National Highway Traffic Safety Administration has estimated the annual costs associated with fatigue-related crashes resulting in injury or death to be $109 billion each and every year, which is just a staggering number for such a preventable behavior.
No kidding. It is a huge number, a huge number. Now, it's not that people don't believe that drowsy driving is risky. Again, the National Sleep Foundation has conducted polls where we show that 95% of the US adult population believe that drowsy driving is a risky behavior. Unfortunately, it just doesn't seem that this increased risk has yet to translate into avoiding this behavior.
So, given the extreme consequences of drowsy driving, what, if anything, can we do about it? Well, the good news is that we know there's warning signs you can pay attention to when you're driving, and then there are actionable steps that you can take. So if you find that you are frequently blinking, your eyelids are getting heavy, if you have drifting thoughts and it's hard to focus, or repeated yawning, this is time for you to take action.
And what do we mean when we say that? Well, the first thing I like to always think of is to be proactive. Plan ahead, right? Plan regular stops in any long trips. We recommend that you plan a stop every 2 hours or about every 100 miles. We also suggest you bring a companion with you. Now, not only will this just make your long trips more enjoyable, but this companion can also look out for the warning signs, can engage in stimulating conversation, these sorts of things, and you can share the driving load. Of course, if you experience any of these warning signs, Natalie, pull over. It's not worth it. When you pull over, take a nap. Even 20 minutes can be reinvigorating. Drink some caffeine. Do whatever it takes to get to your final destination healthy and safe.
And of course, Joe, one of the easiest things that you can do to prevent drowsy driving is to try to get an adequate amount of sleep. And we're lucky that the National Sleep Foundation has helped achieve a consensus about how much sleep we actually should be getting. So for the average adult, you need 7 to 9 hours to feel well rested. For older adults, it's a little less, 7 to 8 hours. And importantly, for teenagers, it's more, 8 to 10 hours. We know some people will fall outside of these ranges, but these are good guidelines for knowing how much sleep you need.
And there is, Natalie, a direct relationship between how much sleep you get on a nightly basis and how often or frequently you engage in drowsy driving. So our data suggests that drivers who are better slept, who have slept during, these recommendations, this duration, they're simply less likely to drive drowsy and less likely to do so on a regular basis. The main point is get the sleep that you need, and you'll be less likely to put yourself and others in danger by driving drowsy.
Yes.
The National Sleep Foundation is dedicated to improving health and well-being through sleep education and advocacy efforts. NSF is the trusted resource for sleep science, for healthy sleep habits, including information on drowsy driving, and for sleep disorders to medical professionals, patients, and the public at large. There is only one National Sleep Foundation. For more information, I encourage everyone to visit our website at theNSF.org.
And lastly, we'd like to leave you with some important messages about drowsy driving. Thank you for listening.
Be safe, everyone.